Delegates and family, nominated by President Biden, our next guest was confirmed by the Senate and sworn in as the 11th Secretary of Veterans Affairs on February 9th, 2021. He previously served as White House Chief of Staff for President Obama. During the confirmation hearings for his current position, he said, "There is no more sacred obligation nor noble undertaking than to uphold our promises to our veterans, whether they came home decades ago or days ago." His leadership and advocacy were important factors in the passage and enactment of the Sergeant First Class Heath Robinson Honoring Our Pact Act, which indeed enables VA and our country to uphold the promises made to veterans. He has also led VA during its first National Buddy Check Week, which was held in October. Please give a warm welcome to the Honorable Secretary of Veterans Affairs, Denis R. McDonough.
Good morning, everybody. Good afternoon, everybody. Thanks for having me. Commander Seehafer, Dan, thanks for your service as a Navy chaplain, as the Legion's national chaplain, as commander of the Wisconsin Legion, and now as national commander. Your life's work has been caring for and ministering to service members and veterans. It's personal, as you often say. Thanks also for your leadership of our nation's largest VSO, the nearly 2 million members of the American Legion over the past year. Let me also recognize all the past national commanders in attendance. Shanin, your executive director, and his team. Thanks for their work and all that we've accomplished together. Rodney Rowland, your national adjutant. And let me give a shout out to Dan Wheeler, who recently retired after 45 years as your national adjutant. Dan, enjoy your retirement. You've earned that. And all the other national officers, vice commanders, and every member of the Legion here today. It's an honor to be with you again. Thank you for your partnership in serving veterans, their families, caregivers, and survivors. VA has no better partner than you. As the Civil War was ending, President Lincoln charged the nation to care for veterans, many of whom had given their life's blood to save the Union. 160 years later, President Biden calls the commitment to service members and veterans our country's one truly sacred obligation, preparing those we send into harm's way and caring for them, for you, when you come home. Now, presidents and Americans make that commitment. VA's job is to keep it. The Legion helps us do that, and holds VA accountable to that obligation. You hold me accountable to that obligation. Accountable to ensure VA is caring for you with the same conviction, determination, and devotion that you showed the country. We at VA work for you. Last year in Charlotte, I reported that we'd had a record-setting year, delivering more care, more benefits to more vets than ever. 2024 has been another record-setting year, because rather than expecting you to change your life to fit into VA, we're changing VA to come to you. That means communicating with you by email, by text, by phone, through the media, in person at over 550 in-person events. That means serving you where you are, like right here at this convention. VA's had VHA and VBA outreach teams here this week to assist you with PACT Act enrollment and information, with post 9/11 military to VA transitions, with applying for benefits, with suicide prevention resources and outreach, and with caregiver support. We're here to serve you because we work for you. Working for you means providing all vets timely access to world-class care. And I'm glad to report that more vets are enrolling in VA care, now up to more than 9.1 million. In just 2 years since the PACT Act was signed into law, 710,000 veterans have enrolled. 40,000 of those vets enrolled under the new PACT Act eligibility that we expanded years earlier than the law required. And more vets are using that health care once they have it. Vets will get 127 million appointments at VA this year, far surpassing last year's record of 120 million. And remember, your health outcomes are better when you're enrolled at VA. VA care is the best, most affordable care in America for vets. One report called it the significant VA advantage. And we're seeking more ways to deliver that care more efficiently. If you're enrolled at VA and you're concerned you need to go to an emergency department, you can call your VA Health Connect Vision Clinical Contact Center. VA Health Connect gets veterans and caregivers to the right care right now on the phone with a real person 24 hours a day, 7 days a week, 365 days a year. Clinical triage is one of those core services provided by the clinical contact centers, allowing vets to talk to care providers about symptoms and concerns and to receive recommendations immediately for health care. VA has clinically triaged over 4 million cases since the start of FY23. A VA nurse will immediately work with you to get you timely access to the right care. That might be a VA tele-emergency care doctor, a virtual clinic visit that day, or an appointment with your primary care provider. And if it is an emergency, the VA nurse will call 911 for you, stay on the line with you until that help arrives. Nearly 48,000 vets have already used this new tele-emergency care option. And nearly 60% of the veterans who have called had their issue resolved on the phone with that tele-emergency provider. Tele-emergency care will be available in every VISN in October. It is such a commonsensical idea that you just know it didn't start in Washington. The idea was hatched by one of your fellow vets, a Marine, VA employee who knows that we work for you. Better care at VA is important to our fastest growing demographic of veterans, women vets. More women vets are now choosing VA care than ever before. This past year, over 50,000 women vets enrolled in VA healthcare, the largest enrollment of women vets in a single year ever. The number of women vets using VA service has steadily grown from around 413,000 in 2014 to 630,000 today. We're determined to provide women vets with the highest quality care available. Comprehensive and preventative screening for conditions like osteoporosis, nutrition, and heart disease. Expanding breast cancer screenings and mammograms. Enhanced gender-specific services, including gynecological care, reproductive services, maternity care coordination, provided for pregnant vets from 8 weeks to 1 year postpartum. This is about building trust with women vets, about working harder for all vets. Now, working for vets also means getting claims decisions faster. A decade ago, decisions on average took nearly a year. Now we're down to half that, about 155 days. We've grown our VBA workforce, and that workforce means business. Last year, we made nearly 2 million claims decisions for vets. This year, we're on track to make 2.5 million decisions. Since President Biden signed the PACT Act into law 2 years ago, nearly 4.5 million claims have been filed. About 1.1 million vets have filed PACT Act claims with a grant rate of 75%. but there are over 6 million vets that qualify who have not yet filed a PACT claim. So there are millions of eligible vets and survivors who haven't filed for PACT or for any other service connection. We need your help to encourage vets and their survivors to file, and to file with accredited VSOs, like those from the Legion. We, the Legion and VA, can't stop working until every vet, every survivor receives the benefits and the services that they've earned. Recognizing we work for you means that how we provide care matters too. Right now, vets tell us that they trust us more than ever. Our most recent veteran satisfaction ratings show that the highest trust scores since we started tracking them back in 2016. I believe those results reflect the fact that more vets are getting benefits, health care, and services they've earned and so rightly deserve. That's what working hard for vets is all about. Now, as a result of bringing more vets to VA, we've exceeded our most aggressive projections from the beginning of this year. That's why we've now told Congress we need more money to keep delivering benefits and care to veterans. We're projecting that we need nearly $3 billion more in this fiscal year for mandatory benefits payments to the nearly 7 million vets who get monthly benefits checks. And we need it by September 20th so that the October 1 checks aren't delayed. And next year, we'll need an additional $12 billion for medical care. So we're working with Congress, with the Office of Management and Budget, to address these needs and to continue delivering care and benefits at record rates. That's what vets deserve, and that's what matters most. Now, I'd like to hear from some of my colleagues, dedicated employees working hard for you and for all vets. Let me start with Bob Manis. Bob, the floor is yours.
Thank you, Mr. Secretary. Good morning and welcome to New Orleans. My name is Bob Manis. I'm the Executive Assistant to the Medical Center Director here at the New Orleans VA. I'm a retired veteran, 20 years in the Navy, and again, welcome. I want to give you a little reasons why I work for the VA. First of all, I come from a healthcare background. I've been in healthcare since learning first aid as a kid, serving on a ship in the Navy as a hospital corpsman, on the air side also, and finally working for the VA since 2000. Another reason that I work for the VA is a sense of service for family. Coming from a military family, my father, my stepfather, brothers, sisters, cousins, and their spouses have all served in the military, and I do it for them. I want them to make sure that they are provided the services that they've earned. And finally, this is very personal. A few years ago, when I came back to New Orleans, I had some vision problems. Didn't really pay any attention to it, thinking it would go away, until I noticed that my vision was affected. So I called my ophthalmologist, who just happened to be at the VA in Jackson, Mississippi. He said, "Bob, stop what you're doing and go to the eye clinic." I went over to the eye clinic, and within hours, they had diagnosed a retinal vein occlusion, which is basically an eye stroke. They did some initial treatments, and then the following Monday, I was receiving comprehensive care. And to this day, I credit the VA's ophthalmology department with saving my vision. I'm still a patient. A few years ago, I was at a veteran outreach event, and we were talking to some veterans that were Marines. And talking to them, we were asking them, what can we do to help you? I was with my hospital director, and we both were taken along a journey, and a Marine was telling us that the Marines did a very good job on teaching them how to kill. What they needed from us was to help them learn how to live afterwards. That statement, that conversation still resonates with me today. Every time I'm working with a patient, doing my job, making sure that the doctors have the supplies and the resources that they need, I think that I'm helping that Marine live. And with that, I want to thank you and introduce our next, Dr. Ernest Sneed, who just so happens to be my physician. Thank you.
Good afternoon. Welcome to New Orleans. Please enjoy the good food. Please remember to enjoy the jazz music. So when you meet with your doctor and he or she is concerned about your cholesterol or blood pressure, you can say you try to do some exercise by dancing to the jazz music in the French Quarter. My name is Dr. Ernest Sneed. I always introduce myself to my patients by saying, just remember, if you needed a doctor, add an S to it, Sneed. That's my name. I've been with the VA for 27 years. I go back to my training at the Lock Raven and Pratt Street hospitals in the Baltimore area. And I've also served at both the Perdido and now the Canal Street Hospital, the VA in New Orleans. The best thing I like about the VA is in a very enjoyable environment where teamwork rules. It makes it very interesting and very easy to take care of our patients. My most memorable patient was a World War II prisoner of war patient, and I was with his family. During my evaluations, in his medical records was the original Red Cross letter he sent from his family, from his POW camp in Germany, to let his family know that he was alive and well. That's a very humbling experience. We were able to secure all his needs and to make sure he had a life of comfort for which he greatly deserved. The Secretary mentioned about the PACT Act, the Patient Aligned Care Teams. Please take advantage of the PACT team. We're all there to serve you in a timely manner and to address your needs so you have a healthy and enjoyable lifestyle. Once again, please enjoy yourselves while you're here in New Orleans, and as soon as possible, if you are not already enrolled, please take advantage of the PACT Act and the patient-aligned care teams. Now I will turn it over to Mr. Isidore Sims.
Good afternoon. I'm Isidore Sims, a veteran of the greatest Navy in history. In October of 2000, I was stationed on board the USS Cole, where it was struck by suicide bombers. I was one of 40 sailors that was injured on that day. I received a Purple Heart as a result of my injuries, and I lost 17 of my shipmates. I worked for Veteran Benefits Administration for 12 years as a legal administrative specialist, focusing on outreach. When I first joined the VA, my primary motivation was to gain a thorough understanding of the processes behind the claim decision-making. I was eager to learn how the system worked, as I believed that knowledge is essential for serving those who have bravely served our country. I achieved this goal and then dedicated myself to a second career, helping my brothers and sisters. Working at the VA has been a time of continuous growth, learning, gaining a deeper understanding of many aspects of veterans' needs, and the importance of structured support systems within the community. As a legal administrative specialist, I strive to understand the compassionately navigate the legal frameworks that govern veteran affairs. I work to serve as a bridge between government directives and veterans, and I find the communication strategies needed are like those that I use as an intelligence specialist in the Navy. My focus on outreach includes listening to veterans. I listen while organizing, while participating in community events like this one, during information sessions and benefit workshops to foster a supportive environment. My most satisfying experience serving fellow veterans happens nearly every day. I found it in their gratitude or in knowing that their needs, their benefits, which they rightfully deserve, have been delivered. I believe that veterans in civil service, especially the VA, are critical to understanding and representing fellow veterans. My Navy service enables me to understand and build respect with other veterans as I work to serve their interests. In closing, I'm appreciative of your time this afternoon and your presence in the great crescent city of New Orleans. And we are all working towards greater things for our brothers and sisters in arms. Thank you, and I turn back over to the Secretary.
Bob and Dr. Sneed, Ernest, and Isidore, thank you very much. And you all see now why I love working with this awesome VA team. And that's where we are in 24, providing more care, more benefits to more vets than at any time in our history. And we're proud, but we're not satisfied. And we're surely not finished. How could we be satisfied when there are millions of vets who qualify under the PACT Act, but who haven't yet filed their claim? Even more importantly, how could we be satisfied when we're staring down a monumental public health crisis where 6,000 veterans a year die by suicide? Because they've become convinced that they're a burden on this country, which they have done so much to strengthen. In a country that so badly needs them. How can we be satisfied until every veteran in crisis knows that there is hope, that suicide is preventable, that help is available, and that treatment works? So no, we are not satisfied. And that's the reason I came back to see you again this year. To hold myself and VA accountable to you, the veterans we work for. So thank you for your partnership these last 4 years. VA has no better partner than the American Legion. God bless you all. God bless our nation's service members, our veterans, their families, caregivers, and survivors.